Okay, just to welcome you all here this afternoon, to say that my name's Emma and I run Adult Cerebral Palsy Hub along with Miriam. And one thing that we've been noticing on lots of the chat sites is that people asking lots of questions about things that they might be able to do to keep moving whilst we're still in lockdown or partial lockdown, depending on where you are in the country. So we thought we'd take the opportunity, because we are very lucky to have Miriam, who's a neurophysiotherapist, as part of the team, just to open it up for questions. But I think the way that Miriam's going to do it is to start with a really short presentation in which she's included some of the questions that people have sent her throughout the week. But then we should have hopefully some time at the end for people to ask some individual questions if that's what they want to do. If you want to write any of the questions that you have as we go along in the chat, then I will try skillfully to be reading those at the same time and make sure that we cover everybody's questions before we reach the end. I hope that sounds okay. And the other thing just to add is that we are recording this session, I hope, so that we can then share it on our social media channels. Particularly, we will put it on our YouTube channel so that people can have access to it, because I know there was a few people that wanted to come today and couldn't. So I'm going to unmute Miriam by the powers of technology, and then I'm going to share my screen. Okay. Over to you, Mim.
Okay, so first of all, thank you, Emma, for the tech, because it's phenomenal and really, really helpful to me. I'm just going to see if I can see you, at least some of you, as I'm talking, because it just is nicer to see some smiley faces when I'm doing this. So I've done this session because there are so many different conversations that have come up during the Zoom chats. And I just thought it would be really useful to help start us talking about how we can learn about some of the things that we need to understand about ourselves and our bodies, and it's just as a forum to explore together and see if there's anything I can help with. What I'd like to explain is a little bit about my background. I am a neurophysio. I'm an adult neurophysio. So I have learned what I've learned regarding adults with cerebral palsy through experience. I don't have the same knowledge, depth of knowledge as a pediatric physio. So I haven't done, obviously I've tried to teach myself, but I haven't had the years and years of experience of working with young children and learning how they go through those developmental stages. I've read about it, but by the same token, as I'll explain as we go through the talk, having cerebral palsy means that there are so many different parts of one's body that is affected by it. And I've learned it from the neuro side of things, and obviously had to expand my scope. So I'm just caveating everything I'm saying by saying I'm not an expert, but I'm learning as I go along, but I've had quite a few years experience now. But we're all gonna, have our own experiences that we can learn from. So can we have the next slide, Emma? Thank you. So the format of today's session is I'm going to give you a brief introductory talk, and then we're going to look at some of the questions that have been posed to me. So they include the difference between general and neurophysio, discussion about fatigue, about hypersensitivity legs, incontinence issues, problems with kneecaps, sleeping advice, pain control, stretches, lower back pain, and how to start being more active. And as Emma's already said, if you've got any questions as you go along, put them in the chat, and I'll try and answer them as we go along, or when we open the floor up at the end. Okay, so let's get started. So one of the roles of Adult Cerebral Palsy Hub, the charity, is self-care. So we want to help the community manage and be experts in their own presentations of their condition. Okay, so there are so many different faces of adult cerebral palsy. Even, you know, the group that we got today, you have different areas of your body that's affected by cerebral palsy. So you'll have different things that you need to be more concerned about. And what we want to do is try and help provide information or direct you to where you can get information and educate and self-empower you. Okay, so that's the basics of what we're trying to start with today. Can we have the next slide? Brilliant, thank you. So some of the effects of COVID-19 pandemic and the lockdown. So first of all, you will have, if anyone has been unfortunate enough to contract COVID-19, whether it was severe, moderate or mild, you will have the effects of recovery from that, which will bring its own challenges. But if you have been lucky enough not to get it, being in lockdown will present its own issues regarding your physical health, your mental health. There will be financial strains if it's caused people to be furloughed or not being able to work for whatever different reasons. Obviously, we've all become a little bit more socially isolated, sorry, bear with me. And we're also adjusting to cohabiting with other members of family or friends who we're living with. And that is sometimes a really great thing and also sometimes a really challenging thing. So that brings its own stresses and strains. So what I wanted to do was think about the bigger picture for us, whether we're in lockdown or pre-lockdown, because coming to that, living with cerebral palsy and needing input from the medical world means that you may be involved with many different teams. So there are many different hospital and community-based teams that could be involved supporting you. So I've just brainstormed a few. There are loads, but I just brainstormed a few. So if we can start running this slide. So we've got the adult with cerebral, us in the middle, and then in comes on the left, the PT, the occupational therapist, the speech and language therapist, the vocational therapist, the dietitian, the district nurse, the nutritionist, and the orthotist. So that's just one area, and I'm sure there's lots of others that we can include. But if we think about the medical side of things as well, we've got the neurological team and the orthopedic teams, we've got the pain teams, the urology teams, the rheumatology teams, the vascular teams, obs and gynae, and again, that is a huge number of people. Now, the reason I wanted to put this up is because I want us as a community to understand that we're starting from a point where the knowledge of adults with cerebral palsy among this group of these huge volume of teams is not big. They don't necessarily have the expertise to understand how cerebral palsy will impact if you have a condition that falls under these areas. And that's one of the things that we want to try, and we are working towards, to raise the profile of the needs of adults with cerebral palsy within the medical world, so that when you do go and see people, if they, one, the website will help you educate yourselves, but also to direct the clinicians to say there is a resource, there is information where you as a clinician can educate yourselves to understand and support your clients as they come through the door a bit better. Okay, so it's a little bit of a empowerment for the CP community. But we have to understand that where we are at the moment, a lot of those clinical teams don't have the level of skills that I personally, as a therapist, would like them to have. and it's something that we're working on and developing, but we as the community of people with cerebral palsy can also educate and inform ourselves to go into them and saying, have you looked at it from this point of view? Have you looked at this resource? Okay, so the next slide talks about a condition which is a phenomenon that we know about, but it's not deeply researched, and it's called post-impairment syndrome. And a lot of you might recognize the symptoms and realize, oh, that's what that is all called. So it's just reading through the slide with you guys, you can have fatigue, you can have pain, you can have bone deformities, we can have issues around repetitive strain injury and degeneration. Okay, and although you may have, as a child growing up, had problems with this joint or that joint as you grew and developed, as you've reached adult maturity in your skeletal growth, different forces and different strengths as you repeated movements through your adult years will also have an impact. So that's the same whether you have a neurological condition or you don't. So people can end up asymmetrical. So for instance, for people that are either, if you're right hand dominant, you've got use of both arms, you can do things with your right hand you can't do with your left hand. That's like that for everybody. Okay, because we are, as humans, develop asymmetrically. For people that are on their feet, they'll know they feel more steady on one side than the other. So if you add on top of that the neurological or the tonal issues that can come with cerebral palsy, then it will create challenges as our bodies age. So what we've seen is that this umbrella term post-impairment syndrome encompasses some of the issues that come with those challenges as we age. Sorry, can we just go back?
No, I'm sorry.
It's fine, don't worry.
Right.
So as we age. Now, if we can move on to the last slide, it's fine, Emma.
Yeah, no, it's fine. Sorry, it's my fault.
So no, it's so fine. So so that's kind of the global introduction, and we're going to come on to just going through some of the questions that people posed to me. So the first one was the difference between general and neurophysio, and I've tried to explain it a little bit beforehand. But basically, most clinicians start with a basic training, and then as you move forwards, whether you're a physio, an OT, a speech and language therapist, whatever area, you specialize in different things. So when we're talking about a general physio, I think we're probably talking about a musculoskeletal physio, because you can have an orthopedic physio or a respiratory physio or a neurophysio. So when you get referred to by your GP to a physio, it's probably a musculoskeletal physio who will have a great knowledge of joints and muscles and muscle imbalance, but they won't necessarily understand the impact of tone and how that affects the pull on different joints and how that affects the alignment of different movements. So from my experience, I don't have the speciality of a musculoskeletal physio. So in my example, I've either had to do some training myself or worked in combination with a musculoskeletal physio, so that we can use both of our brains together to work out the best way to help the client with whatever presentation it is. Whether it's a recovery from a hip replacement or working out how to deal with back pain when we have issues with muscle length. So if you've got any other points around that question, please feel free to put it in the chat, and then I can try and add that on. But I want to keep it flowing so that I can then get through as many issues as possible. So regarding fatigue, it's a really interesting one, and it's a really complicated one. There is a growing body of research in regarding adults with cerebral palsy. It's really small, but it is growing. But a lot of our research, a lot of what we infer is from other conditions. So for instance, there's a lot of research that's been done in ME around fatigue. And we can take a lot of that learning, and they're using that, interestingly enough, a lot of that research is being used with the recovery of COVID-19 patients, because there's a huge fatigue component with COVID-19 patients. And it is there is something around understanding why the fatigue happens, which sometimes allows you to maybe wrestle with the frustration that comes with it. So if we think that we have a certain amount of one component of fatigue is to do with the energy that you use when you're moving. Okay, so when we know that when muscles are formed, when you have CP, not as many muscle fibers are formed in the same way. So what the amount of energy it takes for somebody, for instance, to sit to stand, who has a certain level of CP, compared to somebody who doesn't, it's quite dramatic. So the effort is huge. Now, you can build up your muscles. Everyone can build up their muscles. It will take a lot longer for somebody with CP, but it will also mean that as we age, whether you have CP or not, we lose muscle bulk. Okay, if we don't use it, we lose it. And one of the challenges is that if we don't keep our level of function at the level we have it and try and maintain it, as we lose our muscle bulk, our functional ability will drop down. So as we try and keep doing everything we're doing, it's not always that obvious. It's sometimes very subtle, but it's just all of a sudden walking around all day or getting out of bed, or sorry, going up and down the stairs becomes more tiring because those specific muscle groups don't have enough energy. Now, there's also another component around exercise tolerance, but there's also another area around which somebody else was discussing with me around the psychological aspect of fatigue. So especially in lockdown, we've been thrown into, everyone's routine's been changed. Yeah, so we would used to normally have activities or seeing people or going out or whatever we were doing. And it's all been thrown into slight chaos. So that in itself has created a lot of, not a lot, but some increase in us needing to think about our mental health. And I think that, especially around the lockdown things, being able to just acknowledge what we need, to allow ourselves to process what needs to happen, what we want to achieve in this new routine, and just to own it rather than us feel like, oh, the day's so long, how are we going to fill it? So creating our own new structure will help give us back some of our control. There are so many other aspects of fatigue. So if there's something that I haven't touched on, that and I think the routine does help, but I think that pacing does help as well. So for instance, I think I'm not going to go into any more because I'm looking at the list of things and I'm like, I want to get through those, but we can talk more about it if it's something else that I haven't picked up on. So please feel free to put that in the chat. Now, the next thing is hypersensitive legs. So this is a really interesting one. And again, there's lots of reasons why people can have hypersensitive legs, and there's lots of ways of dealing with challenging it. The first thing I'd say is the more we use our joints, the more we're able to use our joints or have them stimulated, whether it's by ourselves moving or a carer, you know, moving them or touching them, we are sending information up to our brains that gives normal sensation. When limbs are dormant and they get stiff or they get cold or they get maybe sometimes swollen or they get inactive, then they won't be necessarily getting that normal feedback through the joints, through the skin, through the muscles. So there's one angle of hypersensitive legs is that keeping things moving, talking to your neurological nervous system is really important. So whether that's something you can do yourself or you can ask your carer to help you with is something that is being mindful of. The other issue around hypersensitive legs, which kind of goes into a little bit of pain control, is how the different ways of dealing with that, as well as the activity and the touch. So I'm not going to talk about the pain side of it until we get to pain control, if that's okay with everyone. Okay, so incontinence issues. I don't profess to be an incontinence expert at all, but from a physio point of view, there are components around managing our pelvic floors, which could lead towards us wanting to have a gynecological referral to see a gynae physio or a urologist to look at that. There can be people who will have issues because of maybe some sensory disturbance in their bladder. And again, there are different medications that can be explored. So all I suppose I'm going to really say on this matter is there are clinicians that can be approached to explore and investigate. And I think the issue is there's a concept that is fairly, I've learned the new label for it called Diagnostic Overshadowing, which is where things get labelled, oh, it's because of your CP, and it's not investigated fully. And I think it's really important for us within the CP community to say, well, not sure it's completely to do with my CP. Could we maybe get a referral to this clinician or that clinician to look at it in a little bit more detail? I don't think there's anything else I can really say about incontinence, but I hope that gives you enough of a start of an idea of how to proceed with that. Problem with kneecaps. Okay, so this is something I came across when I first worked with people with CP, when I was first training, and it was fascinating but really logical, and also really logical. And it's about how sometimes people find that their kneecaps seem to be drifting up their legs. So they're not over their knees and they're like at the top of their joint. And it's like, well, how does that work? How did that get there? And then they start having pain or discomfort, etc. So if we're talking about, I just want to talk about how that happens and why that happens to start with. So if we think about our tone in our joints, especially if we spend a lot of time sitting, our thigh muscles at the front of our thighs are naturally going to get quite tight. Now the kneecap sits in the tendon of the quadriceps muscle. So if I show you my knee, okay, can you see my knee? So the quadriceps muscle goes from the bottom of your knee joint, just below where your lower leg starts, all the way up to your hip. So it goes over 2 joints. So it's going to be pulling in different over 2 joints. As your tone in your quadriceps, or it shortens because we spend a lot of time sitting, as it shortens, it's going to drag that kneecap up purely because it's sitting in the muscle. I hope that makes sense. So it's because I'm going to just angle my thigh. You get a bit of my leg today. So from here to here, this is going to shorten up and it's going to drag your kneecap up there as this muscle gets shorter. Can I have a thumbs up if that makes sense to people? Thank you. I'll stop flashing my legs now. Okay, so the challenge is to keep the muscle longer. How do we do that? Okay, so one way of doing it is to stretch the muscle out, but it's not always that easy for us to do it ourselves. One way of doing it is to stretch your hip joints out by lying on your tummy, and that stretches out that little bit, but you actually might need some manual work with a therapist literally manually stretching it. It's not the most comfortable thing in the world, but if there's a way of you working out how you can stretch that whole muscle on a regular basis, knowing that your tone goes up in that muscle, it will help prevent that problem occurring or reduce that problem. Okay, so it's quite patient specific, so it's quite difficult to go into more detail than that, but I hope mechanically you understand why that happens. Okay, I'm getting nods, good. Okay, sleep advice. Okay, so having a routine, a bedtime routine is really good. It's probably really obvious, but we are creatures of habit. So if we attach certain routines to certain things, then our body naturally wants to start, gets into the habit of knowing what comes next. Okay, so it's some of what I'm going to say is going to be really obvious, and then I'll go into a bit more detail. So it's, you know, having that going to bed at a similar time, and if I'm teaching you to suck eggs, I really apologize, but lockdown's thrown everyone's routine out. My kids have been a nightmare, so I'm working on sleep advice with them. Having that routine, doing the same things every night, maybe, you know, making sure the room's nice and dark, maybe just reflecting on your day before you go to sleep, and trying not to have so much technology buzzing in your head before, you know, maybe an hour before bedtime. A warm drink, a herbal tea, something like that. Now, the question that I was asked specifically was about positioning in bed, because the person who specifically asked me finds it difficult to move in bed, and there are and they get a certain area of their body a bit sore. So from that point of view, I would say that we need to maybe look at protecting that area, maybe with a pillow, lifting that limb up so that it's not resting so much on directly on the mattress, and potentially looking at different sleep positions, or looking at how you can they can strengthen their rolling ability in bed, so that if they are disturbed by discomfort while they're asleep, it's a lot easier, because you've maybe worked as a goal to get that, maybe your tummy muscles a bit stronger to be able to turn over easily in bed. So it may be that actually We need to make sure the skin integrity on that area that's a bit sore is looked after. But it also may mean that actually a little bit of either looking at your mattress type, your bed mobility, maybe as a goal to work on from a movement challenge point of view, is something that needs approaching. So I'm going to move on from sleep advice. Again, I can't see the chats, so if there's any chats going on with the screen share, I'm not able to see, but actually there are no chats, so that's good. Okay. Pain control. Okay, it's a biggie. The first question we have to ask is, what is causing the pain? Is it muscle stiffness? Is it joint stiffness? Is it tone? Is it problems with the skin? Is it nerve pain? There are so many different potentials that can be stimulating. Is it muscle imbalance? There's so many different things that we have to consider. And I know that you will know your bodies to a certain degree, and you'll know the history of what's happened and what different areas have progressed. But sometimes, whether it's a clinician or a friend, you need a fresh pair of eyes, because you can't always see how you move. And they might spot things that you don't always spot. Like they might spot that you always stand on the same side. So if you always put your weight on the same side, or when you're leaning, when you're sitting in the chair, you may tend to lean to one side, and just historically, and you are saying, oh, I've got a back pain, then it may be that you haven't realized that you actually need to really think about how you're sitting and positioning yourself. And you might need to just do a little bit of re-education. I'm constantly learning about my body as I get older. And it's quite a journey. So I think we all have to be as body aware as we can. There are medications for nerve pain that people can use that have very good results. They do have side effects. I'm not a pharmacist and I'm not a pain expert, but I'm talking about things like the gabapentins, the amitriptylines, as well as the basic analgesics like the paracetamol and the ibuprofen and things like that. But I think it's really important to understand what is the cause of pain, so that we can understand the modality that needs to treat it. For instance, some pain can be slightly overlapping with stretches. It's just the muscles are really tight and they need a release, they need a stretch, that we've got our muscles work in conjunction with each other. So if we've got very tight thigh muscles at the front, we might have slightly weaker muscles at the back of our legs, and they work in tandem. So if one area is tight, it's going to have an effect on the other area. And I think from a pain control point of view, at the moment, I think I've probably covered a certain amount that I can at the moment. But obviously, if there's other questions, I think I've answered the question that the person sent me. But if there's other questions, then please bring them in. The other area of pain control that we did discuss quite a lot on a Zoom meeting, Adult CP Hub Zoom meeting a couple of weeks ago, was the use of CBD oil. And some people have had a lot of experience with them and have got some good knowledge of how it can be used to benefit them. I know that some of the companies that do produce CBD offer support advice lines. So that's another avenue that's new in the armory of dealing with pain. It wasn't here a couple of years ago because it wasn't legal. So that's something, another area. Okay, stretches, big topic, big challenge. How do we stretch ourselves some areas of our body is going to be easier than others. Sometimes of the day will be easier than others. Any stretch is going to be better than nothing at all. But I think that what I'd like you to understand, that I can share with you, is regarding the stretch, we have to be careful how we do it slowly and steadily, because the muscles are like this and they're locked like that when they're tight. Now the fibers slide on each other, and if we do a stretch too quick, we're going to get micro trauma of our fibers. So we have to slowly stretch, maybe hold it for 30 seconds or so, and then release. But once we've done that once, what's happened is you've started to wake up your nervous system. You've started to send signals up to your brain, and you've started to fire up in the sensory areas of your brain. Oh, something's going on here. So when you do it again, not only will that may hopefully be a little bit easier and you might be able to get a bit further, but you're also starting to stretch out the nerves that run by those, parallel with those muscles. So we're going to get some nice neural stretching as well as muscle stretching, which is holistically a much better way forward. I think regarding people finding the right positions, it is really challenging, and I'm happy to talk through with people in a bit more detail another time. Maybe we can do a whole session on different stretches in different areas, and we can bring in another clinician who works really well, but who works as a personal trainer, who has a lot of experience of this area as well. Lower back pain. Again, we need to be mindful of the cause of the back pain. Is it joint stiffness? Is it muscle stiffness? A lot of low back pain, especially in the general population in men, is to do with tight hamstrings, or anyone is to do with tight hamstrings. So if we can work out how to keep those hamstrings nice and long, the hamstrings are these muscles that go down the back of the leg. So when we're sitting with our knee bent in that sitting position, we may have a stretch there, but they're here, that they'll get shortened. So and that affects the position of your pelvis, whether it's like this or like this. Okay, and that puts a lot of strain on the lower back. Positioning in your chair, being able to know whether you can activate your tummy muscles, because they're like our body's natural corset. So if our tummy muscles are really quite weak, they're not going to be able to protect our back as well. From a pain point of view, we've obviously got other modalities like the heat or the cold, cold packs or hot packs that people find, as well as other things that I've mentioned before. And the final area is how to start being more active. So I'll let you into a little secret. I put this question on. So the idea is to start small, to give yourselves small gains, to have a habit, to hook it to something. So for instance, you might decide, right, I'm going to work on my standing when the kettle's boiling, every day when the kettle's boiling, or when you get up and brush your teeth, maybe I will do some squats, or maybe I will do some arm stretches, really bringing my shoulders back. Just do 5 of those, and then that's that. And the next day, toothbrush gets brushed, 5 of those. So just trying to find something that we do every day, a regular habit that we do every day that we can hook onto, really starting small, starting gaining that activity. So although it may not look like it's a big thing, if I said to you, my new habit is that every day I'm going to have a whole dairy milk chocolate bar. I'm stuck. I've had it. I'm locked down. I'm done. I need the chocolate. It's good for you, you know. It's good for me. Over a week or over 2 weeks, I'm going to pile the weight on. Yeah, but that's my new habit, so it's fine. But we can see over time how doing one small thing, even if it's only a small chocolate bar, it's going to have an impact. So if you turn it on its side and you do one positive thing, although it may not seem a big thing at the time, it's small increments over time to build in that habit. It will make a difference. So I think it's 10 to 4 now. I think the talk is done, but if anyone wants to ask me any questions, please feel free. Ooh.
So I wanted to add a little bit about fatigue. One thing that I've learned as I've gone along about fatigue is one of the reasons that we tend to suffer more with fatigue is that it takes much more energy for us to move around. I think the latest information that I've read says that it takes us 3 times as much energy to move than somebody who doesn't have cerebral palsy. And even understanding that has made me understand why it was much more difficult for me to do something that I watched everyone do and found really easy. So making dinner at night, at the end of it, I might be exhausted, and I was chastising myself for why is this so exhausting? Look at everybody else, they can do it. But once I understood that just me moving around was taking much more energy, I understood why I was more tired than anybody else at the end of the day. So that kind of understanding helped me, and then it helped me, I don't know if anybody else feels like it, but it helped me feel I always felt like I had to find myself an excuse for sitting on the sofa, and that I should be being active all the time. But one thing that I've learned is that if I want to do something, so if I want to be an active mummy between 2:30 when I pick my children up and 7 o'clock when they go to bed, then before I go and pick them up, I need to prescribe myself an hour sitting before I get in the car and pick them up. And that was not me being lazy, but that's what I needed to do in order for them to stay active at the times of day that I wanted to stay active at. And I needed somebody to prescribe that for me very specifically, for me to give myself permission to do that.
I think once you accept that,
yeah,
and you get it in your head that is it, that, you know, that it's okay, then you can deal with it.
Yeah.
If you can't accept it, then you can't move on, and it's something that we need to accept.
Yeah.
What were you going to say?
I was going to say also what Miriam was, when she was discussing sleep. I think it's important, and I've done this myself. Before you go to bed, you've got to be, by the time you get into bed, you've got to be sleep ready. I've had to say to myself, you've got to be sleep ready. So like Miriam said about using technology, I was actually on my mobile and, you know, doing different things, and my mind was still alert. And basically what I did, what I do is I sort of like, I only have one light on on one side of the living room, and I'm actually in the darkest part where the light isn't on. Or I might actually turn the light on about an hour before I go to bed, and then I might make myself a hot drink or something like that, so that by the time I go to bed, I don't do it every night, but when I need to, you know, when I need to be up, you know, for whatever the next morning or the next day, I'm actually sleep ready, and that's an important thing for anybody, that, I think.
I don't think it's anything to do with CP. I think it's to us living in a technological age, and that we're bombarded all the time. with whether it's TVs or computers or phones, and our brains are just being overstimulated all the time. So it's just about, we are a generation that has, like you're saying, Dee, needs to learn how to become sleep ready. We've lost that skill.
I think in the lockdown, I think we have improved as well a little bit. I think because maybe we're not commuting as much, or we've been at home. So I certainly feel my sleeping has improved.
Mine certainly has. Be informed of the effects, especially support workers. I think professionals need to be informed of the effects, especially support workers.
Yeah.
The effects of fatigue.
But I think the other thing that I'd like to say is that one thing that I've learned is that informing people that you're not sleeping is a very good red flag for people to understand that actually, if it's because of a level of pain that you're in or a level of discomfort that you're in, that actually that's often a marker for people to say, okay, we've got to take this seriously and we've got to do something about it. So I'm often asked, is the pain keeping you awake at night? Now I know that if I say the pain is keeping me up at night, then people are going to start sitting up and listening and saying, okay, we need to do something about that. And it's about learning what vocabulary you can use to communicate to the clinicians that you're working with or the doctors you're going to see, to actually say, actually, this has got to a point where it's disturbing my sleep and we need to be doing something about that. And whether that is with analgesics or pain medication, or moving and physio, or diagnostic overshadowing, that what I'm presenting with isn't just about CP, there's something else going on. It's quite useful, I think, when we go, particularly when we go to our GPs that are often the barrier to getting more help, to underline the fact to them that actually the pain is getting difficult, it's meaning that I'm getting disrupted sleep, because that's often a signal for them that they need to do something about it.
And do you find maybe living with CP and, Miriam treating people with CP, that they have a higher pain threshold than would you feel that as well?
I've often been told that I've got a high pain threshold. I don't know what anybody else's pain threshold is like. I guess what I wanted to say today was that it's not okay to be living with pain if you haven't explored every option. I think what we often do is say, well, that's the CP and I'm going to put up with it.
Yeah.
And often I've put up with pain for too long. And sometimes that pain is your body telling you something's not working or something's not right, and there are things that can be done about it. So it's about learning to listen to our bodies. I certainly knew that something had changed with the pain in my hips because the type of pain I was getting was different.
Yeah, that's good. Good.
And I think that that's one of the challenges that we have now, that if we are able to, as clinicians, catch those problems earlier, then they may not need such intensive work, or they may not be so debilitating if a joint is supported and protected and investigated early enough. And I think that's what hasn't happened to date. And I'm hoping, that we can raise enough knowledge and awareness and information for the community to say, this is not okay. I need some help now before I can't walk. Like you would if it was if you'd sprained your ankle, you'd have support for that. So just to keep going on with the stiff upper lip is not always the best option. Okay.
Does anybody else have any other questions or other thoughts?